welcome to an episode of YRP Team. This is a session where we get to put a face to RP by having conversations with physicians and teammates, getting a sense to know for the practice. And my name's Anand Singh. I'm a partner and section chief at Radiology Partners Matrix Practice. And today's episode's a special one to me. We're going to be exploring an often rewarding but overlooked part of radiology, and that is of the military radiologist. In a former life, I was an active duty Air Force radiologist myself, and there are a lot of challenges and opportunities that happen for a radiologist that chooses this pathway. And we thought, what better way to explore that than talking with Dr. Matthew Kay, who is an active duty Air Force radiologist who has an association with RP. So welcome to YRP, Matthew.
Thank you.
Hey, so military is different in this day and age. And so maybe you could tell us about your journey. Why did the military appeal to you? How'd you find yourself there?
Yeah. And in fact, it's funny, as I was reading through that question, it's give me some really good chance to reflect on my personal pathway. When I was in high school, I took the ASVAB. Always had a kind of, military service in the back of my mind. At the time, it wasn't right for me. I went and served a mission for my church for 2 years. Came back and it still wasn't quite right. I got married, spun my wheels on trying to figure out what I wanted to do. Started out with doing business and accounting, realized, wow, I really don't want to be stuck in business and I didn't like the rigidity and also like the openness and trying to figure out what I wanted to do for a business. And so I started to look at things in healthcare, and initially it was physical therapy. Started doing some of the shadowing for that. And I had a unique experience when I shadowed a physical therapist that kind of changed my perspective into a broader category of healthcare. And after some reflecting and some introspection, I was able to say, you know what, I actually want to become a physician. The journey through med school actually changed dramatically. My son was born at the first month of med school, and he had an intraventricular hemorrhage, a pretty significant one, and was in the hospital here at Phoenix Children's for about 5 weeks. And I think that not only did that change, how I approached med school, but also how I approached family. Because of this situation I have with my son, and when I started doing rotations, my first rotation was radiology.
I love that. And for folks that don't know, there are a lot of different pathways. For a physician in the Air Force, the classic one is the flight surgeon. And so Matthew here chose radiology. But what some folks may not realize, and you can let us know, a little insight is, you are a physician. So not only are you in the medical corps, but you also have responsibilities as what we would call a line officer. You're a leader, you're an officer, you have enlisted under you extra responsibilities that people may not realize above and beyond your clinical duties. So tell us a little bit about that.
So coming out as a staff to Luke Air Force Base, which is where I'm stationed, our department it's a smaller clinic. It's not a major hospital, but there's probably about 12 enlisted folks here, between sonographers, mammotechs, rad tech, CT, and MR. So we're in charge of making sure that they've got all of their, of course, the administrative things from a radiology standpoint. Their credentialing is up to date, their healthcare training, their computer-based training that we do. We also do ancillary responsibilities as part of the med group here. So we have different teams that respond to disasters. So I'm part of a decontamination team. In fact, we have Luke Days this weekend. So there's a big air show. It's apparently, I didn't really understand the scope of it, but they're expecting to have about 300,000 people on each day. And so we're going to be stationed here at the med group waiting for a response, and, fingers crossed nothing does where we get activated. But if there were, a plane accident or, maybe there's a spill of jet fuel, we would get mobilized to then go and decontaminate these people. And so in addition to coming to work every day and doing radiology, we have a day each week where we assemble together as a team to practice setting up the decontamination tent, donning and doffing decontamination suits, making sure that we understand what our responsibilities are for each station that we're manning, but then also understanding how the different teams work together to respond to any kind of threat or emergency.
I love that. And your ability to work with teams, but as a leader of those teams is extremely important. We're going to touch upon that later as we shift gears and talk about RP. But you mentioned your connection to RP. Can you explore that a little further? Like, how did you discover that? And you say you're an active duty radiologist, you have clinical duties right now, but how'd you find time and that moment to connect with RP?
In the military, they project what their needs are, and so they have a certain number of spots for different fellowships, and so you're competing to fill those spots based on your desire to do a fellowship. The caveat with that is, as you do fellowship training in the military, it incurs longer years of service. And while I've enjoyed my military service, I'm not sure if I want to be committing longer than what my service commitment is for the scholarship that I received for med school. Um, so I wanted to keep that open. But during my last year of school, because knowing that I wasn't going to be doing a fellowship, I was looking for potential a moonlighting job because it was very common practice. And so what I was looking for in a practice was flexibility, knowing that I would have my military commitments, company that would understand that my military service comes first, and the stipulations that kind of come with that, and the understanding of flexibility there, but also just something that I could do remotely as well. Knowing that I was coming to Arizona, I looked at the Rad Partners jobs that were posted for the Arizona area. It just happened to be that one of my co-residents was looking around the same time, and so we kind of stumbled through the whole thing together. We talked to a few different companies up to that point, and a lot of these places were asking us to sacrifice, 2 weekends a month, working 40 hours for them to go through the process of getting us licensed, getting us the equipment, and to me that seemed like a big sacrifice, knowing that I'd be spending a majority of my time as a military service member, and I didn't want to turf 2 weekends a month that I could be spending with my family. And so after I talked with RP, they really understood the situation that I was in. They're very flexible in negotiating this contract that we worked out where as a PRN contractor, I'm able to, commit to as much or as little as I'd like, really. My routine right now is I'm able to, get up a little bit earlier than my family, read for, hour, 2 hours, get the kids in bed, read for another hour, 2 hours, kind of piecemeal. But I'm also able to help cover the the trauma hospitals that they have in the area, where I'm committing to 4 to 8 hour shifts, either when I get off work or on the weekends.
You touched upon it. Tell us the difference between your daily clinic load, the kind of cases that you would see at the base, versus what you see with RP.
Yeah, where I'm at right now is clinic. It's all outpatient. We don't have, if there's even like a whiff that the patient might need emergency services, they're on the flight line, they're working on the jet, they stand up and hit their head and they're worried about a brain bleed or a skull fracture. Like those are not cases that we have capacity here to handle. So we will send those off base. There's a concern for a pulmonary embolism, they will send those off base. Those types of cases aren't seen here. And so we have case complexity, but we don't have case acuity. And I think that being able to cover those hospitals that have level 1, level 2 trauma centers is really beneficial, because those are the things are going to benefit me in my readiness to go and work in Qatar, which is where the Air Force radiologist deploys currently. So I think directly benefiting me to have mission readiness, I'm able to get those cases that I need in order to see, ballistic injuries, or traumatic Humvee accidents, those types of things.
You talked a little bit about flexibility. And so tell us a little bit about, you talked about being important, being there for your family, but also the flexibility, as we've alluded to, you could get deployed, you could go overseas. You'd like a practice that understands that. So talk to us about how that fit into your calculation.
It was absolutely important knowing that a job would be there when I came back. I was on the short list for deployment to go out, this April. My wife was very happy when she found out I would not be the guy that was going. But having a job that had that flexibility in terms of understanding that, I may be gone for 6 months at a time, and knowing that they'd still be able to carry on their workload. Whereas, if I was in a smaller group practice, there may be a little less understanding. I think that having a good team of other radiologists, knowing that they're not going to be absolutely, out to pasture without me.
Now, you had a lot of choices. You could have chosen lots of places to go. You chose RP. So, what are some unique things that RP offers you? Things that you've seen that maybe you can't get in other practices?
Well, to say that, I've got one coworker here who's with the group where he had to, I, these are just like little things, but like he had to furnish his own equipment. So he had to go and buy like diagnostic monitors, had to get his tower, like, you know, he, he's got a supply of these things, and it was really great to have a practice where it's like, you know what, like we will furnish this equipment for you, and when you're finished working, we'll come and pick it up. And I think that was really, as silly as it sounds, that was something that was important to me coming out of residency. The family having moved cross country. It's like, you know what, I want to try and keep my startup costs relatively low. So that was important to me. And again, I always emphasize the flexibility. Um, that to me was the very most important thing. I didn't want to have to commit to, you have to work this many shifts, this many hours every single week, in order for us to keep you on.
It's really interesting. You've just started, but if I could walk you forward and say, like, what does the future for Matthew hold 5 to 10 years from now? And then couple that with where do you see radiology and what kind of radiologist would you like to be?
There's still a lot of unknowns there, but knowing the situation I have now, where I'm working with a great company that I'll be able to go pretty much anywhere with, um, that to me is encouraging. Like I could basically, separate tomorrow or stay in the military and retire in 20 years, and I could still be working with the same great group, right? I think the AI initiatives they have, I think, are just going to continue to get better. I think there's some really promising studies that are going on, and people and vendors who are developing really good products, for assisted detection, second read type things. I think that I certainly don't think that the demand for imaging is going to go down. If AI is able to take care of some of the arduous tasks and make it easier for us to help detect these problems, and give it in a quantifiable way, right? Like the radiomics, right? Like, let's quantify some of this, and provide value for studies that patients really didn't know that they were getting. You're getting a chest CT. Well, if we have an applet in the background that's able to pump out a calcium score on this while we're doing your lung screening, I mean, that's a beautiful thing, right? Where we're not having to, where right now we're having to do two separate studies. And I think we're able to bring that value to the patient. And I think that AI is going to enable us to do more and more with things like that.
You sound like you're really positive about the experience. So you must mention this to other radiologists. What do you tell them when you're like, hey, got this gig at RP and I think you should check it out too?
Yeah, there's a cadre of us from Portsmouth that are all with RP. I tried to get both of my coworkers here on. One of the guys had already signed a contract with a different group, and wanted to give that a shot before he committed. But my other coworker was looking for a job with the same kind of flexibility, and I sent him RP's way, and he's going through the conditioning process now, with a different group within the Phoenix area. Um, but he's really excited to get started and get going.
But we've been talking work the whole time. So like, what does Matthew do for fun? Like you've got all these responsibilities, but like, what do you like to do? I gave you a day. What would you do?
Yeah, I being in the military and being at a base that's mostly a clinic, I pretty much work out every day. That's what I really like to do. So I'm able to go and hit the gym. There's actually a gym just right across the street from where I'm at, so I'm able to go and do that every day. But you can see like all my pictures here. So I've got 4 kids. That's like my whole life. I love my kids. So if it's not taking them to soccer, between 3 kids actively in soccer, it's pretty much at the soccer fields, at least 2 nights a week. They're all doing swimming lessons, and luckily they all get that on the same night. One kid in swim team. So a lot of it's, in the throes of parenthood, ages, 9 to 1 year old. So it's a whole spectrum. I love cooking, so most nights when I get done here and I get home, I'm able to make a meal, right? But on the weekends, I'm really able to kind of flex and do different things. I'll find a recipe that looks interesting, and I'll try and make that. And we have some wins, we have some losses. My kids are my harshest critics, um, but do that. I did. Oh, I don't have them here today. I actually officially joined the Air Force, and I got a set of golf clubs. Um, so I'm actually able to start enjoying some of the amenities on the Air Force bases by doing some golf.
Anything else you want to mention, like when you think about where you are right now as you work with RP or the future that we haven't touched upon today?
I honestly, I don't know. I feel really lucky to be in the situation I'm in. I, I'd say that if this is seen or watched or heard by residents, there's light at the end of the tunnel. It gets better. Um, it doesn't always get easier, but it does get better. But I do really feel very lucky to be where I'm at. From a personal standpoint, professional standpoint, I think that I'm in a really good spot.